Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Welcome, everyone, to the Soulful Surgeon Podcast. I'm Dr. Lisa Hunsicker, and today we have two very special guests, Dr. Jodi Widner and Dr. Radhika Acharya. These are some great pals of mine, and we have spent, 20 years together? We started this journey together, and we've all had kids together, and so today's topic is about physicians in parenting. And so we're going to spend some time. We've all parented together and we've lamented together and really supported each other through all of this time. Jodi, tell us a little bit about yourself.
So thanks, Lisa. So I'm a general surgeon, but I specialize in breast cancer surgery. So I work with Lisa a lot. And I am the proud mother of a 14-year-old boy and a 16-year-old girl.
And Radhika, tell us a little bit about your family.
Yes. Hi there. Thank you for having me. Acharya, I've been in practice, as you said, for 20 years. Crazy that it's been so long. I have two 16-year-olds, so twins, which was quite a journey and story in and of itself. And we have lots of fun.
So let's start off with that. Tell us, how did you start your family? Because everyone has their own unique story. Mine is obviously because my wife and I, we're not the traditional family, so we didn't start children. And everyone, hi, I'm Lisa Hunsicker, and I have a 19-year-old son who is a college sophomore right now. So Radhika, tell us a little bit about your family.
Yeah, got married and just imagined we were just going to have kids right out of the gate. Never thought there would ever be an issue. And I was in my fellowship and had my first miscarriage. Coincidentally, I was on my genetics rotation at the time. And that kind of revealed sort of the reason as to why I had the miscarriage. And they just said it's just a matter of odds and just enough pregnancies and you'll get pregnant. So about 7 years later, we were having lots of pregnancies, but not actually able to carry to term. And a cousin of mine said, "Did you ever think of a surrogate?" And I'd never thought of that. And so we found the perfect surrogate and we have twins and boy, girl. So it ended up perfect.
That's fantastic. And so for us, obviously, as a gay couple, we went through the bank and we did IUI, and all of a sudden we had a baby.
I know. Crazy how that works.
Yeah. And Jodi, any issues with you?
No, I mean, my problem was we thought, okay, let's start to think about having a kid. And pretty soon, like within a month, I'm pregnant and didn't plan for that and I was told during my surgery residency that I would not get pregnant by my program director. And I was an old soul by the time I had my first. I was 35 because you didn't get pregnant during surgery residency. There was just not enough bandwidth. And I had meant to wait a couple of years after residency. And before I was maybe out 6 months, and all of a sudden, here we go.
Yeah, that's very similar to me as well. Doing a surgical residency, that was not something that was really a good idea. We were just so busy, and I had pretty much committed to myself to not get pregnant until after I'd finished board so that I could really commit to spending time with the baby and not having too many other things, especially trying to get board certified. So it's always difficult, any one of those, doing a surgical residency or a surgical practice, getting board certified and having a kiddo. I wanted to try and be as thoughtful as possible. And the good news for us is that we never woke up surprised that we were pregnant.
This is true.
So now with all of our jobs, we're so busy all the time. What do you all do? How do you balance, and what are the things that you do to build in time with your family versus all of our work schedule?
I happen to be a really early riser, which I think has been super helpful. So just getting up early and getting all of my things done, whether it's exercise, whether it's charts, whether it's emails, getting caught up on that early in the day before everyone wakes up on the weekends is something that I've always done and been super helpful. And then I also have really put some boundaries around making sure I attend the kids' events, whether it's the Halloween parade that they had at school. I would just leave work. I was running all over the place, like I'm sure you guys also were, but running, catching the parade, and then leaving and coming back to work, doing all of that. But I did try to make most of their events.
Jodi, how about you?
I think for me, it wasn't surgery is very unpredictable. And so it's not something that you can say, oh, yeah, I'm going to be able to make that because I was supposed to be out at 3, but really we didn't get done till 6. And so that was one of the issues always with my schedule. So you just have to make choices and say, okay, I'm not going to make this particular thing. And I would ask the kids and say, okay, how important is it that if mom's here for this event? And if they said, no, it's really important that you're there, then I would block my day and make sure that I could get there. But there were a lot of things that the Mother's Day tea in the middle of a Tuesday afternoon, I'm not going to make, right? Because the kids just didn't think that was important. So you just have to make some tough choices sometimes, and it's hard. But for the most part, I don't feel like I missed major things, and I made a point to not miss those big ones.
I feel like one of the things that you and I share is that the OR is very unforgiving. And so we have a lot more flexibility in our clinic, but it takes so much to get into the operating room. And certainly many of our patients are cancer related. So those cases, you can't really say, hey, I've got a tennis match I need to go to.
Right?
And so I just think that, at least for me, one of the things that we just talked about is, look, on Mondays and Wednesdays, it's really difficult for me to be anywhere reliably. And what do you have on Tuesdays and Thursdays and Fridays or on the weekends? And let's try and plan as much as possible. And we'll wiggle. And sometimes I'll be able to be there and sometimes not. But I think similar to what you all have said, trying to find out what's the most important and being there whenever you can.
Right.
Any guilt about missing important events?
I think that's the nature of motherhood is being guilty, right? So I don't know. I don't think you get away from that no matter what you do. But yeah, I think different times. I remember dropping Riley off at daycare when she was tiny, and she was still my only child at that point, and she was 2. And I was dropping her off, and she would just cry and cry because she was the very first kid at daycare every day because I had to drop her off at 6:30 so I could be to the OR by 7:30. And so she would grab a hold of my leg and scream. And finally, and I'd cry walking out the door. And finally, the lady at the desk said, she's playing you. And I said, what do you mean? She is absolutely fine. The minute you walk out the door, she is happy as can be. And she's thrilled to be here. But I had this huge amount of guilt every day that I would drop her off. And once I heard that, we changed a few things at home and then she stopped doing it. And it was great. But it was just, I remember feeling so horrible that I was always the mom dropping kids off in the dark in the winter. And so I don't think you can get away from it so much, but you just learn how to recognize it didn't hurt them in the least. She did just fine.
Radhika, how about you?
Yeah, no, I agree. I don't have a lot of guilt over missing events just because, as I mentioned, I think I have a little more flexibility, although oncology can be challenging and unpredictable in a different way. But were my kids the first to be dropped off in the morning at daycare and the last to be picked up? Yes. It was, like you said, Jodi, dark and empty, and they
Right.
come out to the doors sheepishly, and you have that guilt. I remember a story. We've run through a million nannies and a million babysitters. And one morning, it was a Saturday morning, and I was home, and my son came out of his bedroom and was on our balcony that's above our family room. And he starts rattling off, Becca, Jennifer, Michelle, anyone. And I'm like, oh my goodness, I am scarring my child.
Right.
He doesn't have any clue who is downstairs, who's going to be watching him for the day, who's going to be taking care of him. And he just never said the name mom. It was just like every other name in the book, but not mom. But that was a long time ago. He's pretty young, but it's pretty telling.
I think the younger they are, the less they understand and the less that you can explain to them and just help them understand what's going on. I know that there was one time that I had to take a patient back to the OR and it was about 9:30 at night and I had a babysitter that came and stayed with him. And so they called and the my phone was connected to the overhead speakers and so it came on in the OR and so the whole staff and the whole OR could hear Kai, and he was probably maybe 3, and he's, "Hi, mama." And it's this booming sound over us, and we're working, and, "Mama, where are you?" And then I was like, "Hi, baby, I'm so sorry I can't be there." And he's like, "Why aren't you tucking me in bed? You're supposed to be here." And the thing is, like, everybody who was in the staff had the same issue. Everyone had kids, and everyone's kids were going to bed, and we were all together doing this emergent case that needed to be done at night, and everyone was just sitting there and everyone's ready to bawl. And I'm like, "I'm so sorry. You need to be here. Just come here." And
Aw.
I just felt terrible. I was so guilty. And you come home and you see him, and then you just grab them in bed, and they're, of course, unconscious. And you could drive a truck through there and they would never know that you're there. But trying to resolve some of that guilt about that, and having that boom, it's like God. The speakers. I'm like, "Where are you?" How about with the kids? I think they're exposed to us as physicians, and certainly we have very strong thoughts and feelings about medical knowledge and things like that. And I think that we have the ability to impart all kinds of things to our kids starting from a very young age. Anything that you can think of that you made a point to teach the kids that you feel like it was really important to you based on what you do? Any medical stuff that you feel is important?
From my standpoint, I think I've just imparted just obviously being healthy and just really treating your body with respect. And if you treat it with respect, it's going to treat you with respect back. And so we do talk a lot about nutrition and exercise and things like that. I think it's always trying to find a balance between not having it be fear based or giving them issues, but really just trying to tell them that it matters and it's important, and then try to be a role model for them. And that's really what I've tried to do.
How about you, Jody?
I think mine is probably more, not so much being a physician, but becoming a physician, trying to impart in them that you can do whatever you set your mind to. I did not come from a family of doctors. I wasn't expected to go to even college. And so trying to encourage them that there's more out there and that you can be whatever you want to be, that you can really push and the sky's the limit, and trying to encourage them to explore all of their options as they get older about what they can and can't do. But also then just to also impart that empathy that you need as a physician into their lives, and saying, this is, you may not agree with somebody, but you need to be kind. And so trying to impart that piece as well.
Yes, I really think that kindness goes a long way. And I think we really have talked a lot about that in our family. And I think, especially because Krista, my wife, is a trauma surgeon, we see all kinds of relationships that people have. And I think that we have relationships with our patients, but we also have relationships with our families. And I think teaching, at least for me, teaching our son about there's all kinds of people who are in all kinds of situations, and what assume what you
Mm.
think is going on, be that person that steps in and asks. And I've been really excited because he really has grown into a very thoughtful young man. And there has been times where I've seen other people who are in very tough places that he really has sat down with them and had very mature conversations with them, and was able to be very present and listen to them. So I'm very proud of him for that. And I think seeing us model that. I think the other thing, like Radhika, I think we pay great attention to nutrition, and we try and part as much as we can to the teenage diet of let's have some semblance of real food in here. I think since he's moved out and he's in college and he's now cooking, I think that there was a brief time in the very beginning of his freshman year where it definitely was more fast food, but I think he's coming back to center again. And he was home recently and said, "Can we please have a big salad?" So I feel like, oh, we're making
Wow.
he's making his own choices now.
Yeah.
So how about, like, with we have really hard days, and I think that all of us have, especially working in oncology, we have hard days, we have hard situations with patients, we have patients that we care about, patients that pass away, or just really terrible interactions that occur. And we have, whether it's we're upset with something that's happened or we're mourning or grieving. How do you talk to the kids in a
Yeah.
way that they can really understand that? But I think we have so much emotion about it, and we spend a lot of time in that place at work where we don't have a ton of emotion because we have to absorb and we have to be present and take care of the patient. But then when we get home and we're having our own emotions about it, how do you talk to the kids?
I think that's been hard. I would say that has been one of my bigger struggles because obviously, as you mentioned in oncology, it happens very often, unfortunately. And I think in the beginning, I just never really wanted them to see my emotion because I didn't want them to feel hurt. And then I honestly went through a phase where I talked about it, maybe honestly too much. And I didn't want them to get desensitized to it either. It actually has been a tricky balance for me to make it where if someone does pass away, it's meaningful and we can talk about it and they can see my emotion, but not to talk about it so much that they just think that it's so natural. It obviously is natural to pass away, but so natural that they become desensitized and they don't care. And so we've talked about the emotions that go with death and dying and how they would want to be remembered or how they might remember someone who's passed away, even close family members or close friends. So we've definitely had those conversations, but I would say for me, it's been a struggle to figure out the best way to handle it.
How about you, Jody?
Think when I have those tough days, and oftentimes for us, it's not necessarily somebody dying, thankfully, but it can be just a difficult interaction more so. It can be like I struggle more so on those days where I feel like I didn't do my best and I wasn't my best self with an interaction with the patient. And that's where I struggle and come home carrying a lot of that weight and saying, oh, I should have said this or I should have explained it this way and maybe they would have understood. And so those are the times that I really have the biggest struggles. And so I think it's hard to explain that sometimes when they're little. You can just say, Mommy had a hard day. And usually then they would cuddle up with me and we would just enjoy that time together. And that was enough. As they've gotten older, my daughter especially, who's very cerebral, is very interested in, so how did you explain, or what could you have done different, or so she wants to know more information. And so that's been fun as she's gotten older and much more mature, just learning how to interact with each other and learning how to try to explain things in different ways and why some people feel the way they do or don't. And so I think talking about it is helpful, but sometimes just having my son lay in my lap is also really therapeutic. There's just a lot of comfort and learning happening, and that's fun to watch.
I think one of the things that I struggled with, and it's a little bit better now because we're empty nesters, but I think you deal with all those emotions and you have these difficult interactions, and then you're stretched already with your schedule, and then you're trying to get home, and then you're on the busy after
Mhm.
school schedule and you're trying to get through all of these things and you're trying to get up and
Right.
it's I don't feel
Mhm.
up and go team.
Right.
But I think in the past, I think I've been very quiet. And I think my family has noticed that I just get quiet and it's like, why are you so quiet? And I don't feel like I can explain it. So in a way that it's too heavy and
Yeah.
it's too complicated and it's a long story for a kid to try and understand. And yet they do need some sort of answer. And I think as I've gotten older and certainly as he has grown up, I've been able to have more conversations. And now it's actually very interesting to have business conversations because he is now in business school. So he understands when I say I'm really stressed because this has happened and this has happened in staffing and this is happening in the business and this interaction happened and all these things. And even when I talk about when things don't come through, when we order something, oh, so that's a supply chain. So it's interesting to develop as they age because now as he has gotten older, we're beginning to have some of those conversations. And we just had a conversation. Gosh, it's been like 2 weeks ago. And I told him, I said, I really have a lot of regrets about not being able to be with you more. And he was very kind and very generous and gave me a lot of grace on that. So I think the more that we talk with them, the better that that they're going to really respond to us. And I think we will evolve into more people, more back to human beings, and just them understanding us and actually us understanding them. Now, how about parenting? So I think that a lot of people think that we know everything about parenting because we're physicians. And so is there anything that you think that being a physician has given you an advantage? Or do you think you parent any differently because you're a physician?
I
I think,
don't. I,
yeah.
I think I'm making it up as I go along. Just 90% of people. I
I want to know what the other 10% are doing and how they got their
right. Yeah.
information.
Yeah. But I think it's really funny. I there's no manual that comes with your kid, right? I wish there was a textbook on my daughter because I would love to read it. It would be really fascinating to see what's going on in her head most of the time. But there's not an answer for every kid, and every kid is different. And so I don't know that being a doctor automatically makes you a great parent. And it certainly doesn't, unless you go into pediatrics, maybe that probably helps some. As a surgeon, I didn't know how to take care of a toddler any more than anybody else. And so I feel like there's always this preconceived notion that, oh, you're a doctor, you must know all these things. And I didn't know. And so you're doing the best you can, just like everybody else, I think.
Yeah, I agree. I don't think I've done anything different. I think we just are who we are personality wise and are probably a little more reactive than maybe, at least I should speak for myself, but maybe I'm a little more reactive than I should be. And sometimes because you're pressed for time, maybe you're not as patient. And that's probably the one thing. When we talked about guilt, maybe I'm less patient because we're just crunched for time. I know whenever the kids say they need something or want to sign up for a class, I just do it right away because I just need to take it off my to-do list. And half the time the kids change their mind and they're like, Mom, we say one thing and it's done. And I'm like, yeah, I got to get it off my list. So I think that's the main thing. So now they're just careful what they say around me, and what they ask for because it's going to come to fruition. But I don't think I parent any differently. At least not that I know, just because that's all I know.
I think the one thing that we talked about that we parent differently, and I imagine this with all healthcare workers, I don't think it's physicians. In fact, most of the nurses who I talk to, the PAs and nurse practitioners, pretty much everybody in medicine, but especially if you're treating patients, you're fine. Whatever's going on, like, you're
Right.
fine. You don't have to worry about that. And for example, Kai has had nosebleeds since he was a kiddo, and it's just pinch your nose, you know how to do this. We've done this 100 times, and he's upstairs, Mom, Mom. I'm like, you're fine. He's Mom. And so I come upstairs, and it's like a murder scene. Like, he's done all the things, and I just need some help here. I'm like, oh God, I'm so sorry. I think we have really strive to make that you're okay. Like, I'm teaching you and you should know all these things and you know what to do. And they're just kids and they don't. But on the flip side, I think one of the emotional things I think we deal with, and it's just we know all the worst things of everything. So I feel like when a situation is coming up, we can run down the rabbit hole because we've been down the rabbit hole with other people and we know what that is. And so sometimes even trying to have that conversation with kids, they're like, "What are you talking about? You can't even that's not even a thing." No, it's totally a thing. And so I think we're it's hard to be in the middle because you know all the bad things and then you're like, "Come on, it's not that bad." And
Right.
I feel like I bounce in between here and trying to get to the middle of, okay, I think you should call a doctor and not me. Go to go see the urgent care or whatever. I think you have a problem. How about if you are talking to folks who, any aspect of healthcare, whether they're a physician or nursing or any of the allied, and they're starting a family. What do you think the tip is? What's the thing you think is a great tip?
Give yourself some grace. You're only human, and it doesn't matter what you do or how much education you have. Your kid's going to do what they're going to do sometimes. And you can't always predict that, and you can't always be prepared for everything. And also, then to again set some good boundaries for yourself and some good expectations with both the kids and with your job. So that way you can try to have some protected time when you can with your family, but also set good boundaries for them too, so they know, hey, there's going to be these days I'm not available. And so that way you're setting expectations.
Mhm. I agree. And I also think when you do spend time with them, make it quality time. Put your phone away. Don't be distracted. Don't answer calls. I know sometimes you're on call, so you can't help it, but I think that's really important. Find a good partner. I think having a good partner and having a supportive environment, because they can pick up the slack when you can't be there, I think is really important. And make sure that they understand what you're going through and share your emotions when you've had a hard day with potentially your kids, depending on what age they are and if they can handle the emotional part of it, but also really confiding in your spouse so they understand what you're going through, or partner.
Is there anything you would tell your kids and they're coming to you, and all of our kids are now, they're growing up, and so they're trying to consider their future. What do you tell them when people, and certainly people ask us, "Oh, are your kids going into medicine? Are your kids interested in medicine?" And how do you talk about it? What do you tell them?
I think that in terms of that, my daughter is actually interested in medicine. My son is not interested in medicine. I think I'm raising them or talking to them the way my father did to me. He was a physician, he's a retired physician. And he always said, make sure you do exactly what you want and that you have passion for. And he also said, kids are not for everyone, so don't feel obligated to have kids. And my mom said the same thing. And my mom had always told me to be self sufficient. So I think I'm carrying that advice forward. I want to have them explore all of their options and see what their passion is. Obviously, they have to support themselves. So there's that small piece of it. But I think that they don't have to go into medicine. I don't want to talk them into it. I don't want to talk them out of it. I just want them to see how I'm living and practicing and then see if it's something that they want to do.
I've always really tried to reinforce the fact that I love being a doctor. I love what I do. I love being in the OR, but it's not for everybody. And just because I love it doesn't mean that they would love it, and that they need to make that decision for themselves, and that there's no expectation from me or from their dad that they're going to go into medicine just because I did. I think both of my kids have seen how hard it is and how hard I work and how many hours I have to put in, and that there's a lot of probably just as lucrative ways to make a living, and that it's not all it's cracked up to be sometimes. And so you have to really love it in order to make it worthwhile. And we'll see what they decide to do with their lives. And again, it needs to be a passion. It can't just be because of me or somebody else.
I feel like we serve as role models to them to some degree. Do you think there's pressure on them?
I do. I think that they probably see us. I've heard my kids talk about me, and it's actually really heartwarming. You can see that they're proud of what I've done and what I've accomplished, and I'm sure, yours are too. And it's really neat to see that and hear that. But I think there is an innate pressure because they probably see us as super moms in many ways, doing everything. And I think that just breeds, again, an innate pressure on them to have to succeed and be the same way, even if it's in a different career or profession, but just be that way.
Yeah, I think we had this conversation just a couple weeks ago that my daughter looks at me and says, look at how amazing you are. Look at all the things you do. And I said, yeah, but I'm 35 years ahead of you. So, we've got some time. You've got some time to grow. I didn't look this way when I was 20 or when I was 30. And so again, they're looking at the finished product and not seeing the path that it took to get there and recognizing all the steps that it took. So I just trying to reinforce that the pressure that they put on themselves doesn't need to be there, because they're growing and they're supposed to take their time and make mistakes and learn from them and learn who they really are.
I think a lot of people think that we're the finished product, and I think I'm still trying to figure out,
Same.
what I'm doing and what's important and what's the right thing for me every day. And
Mhm.
navigating that, I think imparting to them of being their best self and making themselves happy. I don't think certainly they have to be in medicine. Certainly my son not interested, at least thus far. He's interested in business, but whatever makes him happy, it makes me happy. And I'm not the finished product, so I can't
Yeah.
really I can't show him what that looks like. Only he can show him what that's like.
Yeah.
Yeah. I think that too, admitting when we've made mistakes or telling them, sharing stories when we could have done something better or embarrassing moments or any of those things, I think is really important to show the imperfections because obviously we all have it. Just may not always see it.
I think it's interesting. My son had a conversation with my best friend from childhood, and he said he was trying to get her to give up anything. Like, and she was like, "Nope, she was a perfect child, and I will go to my grave with all of those stories. We're not going to give it up to you." And I think that's been something that he's actually talked to my folks about just as he's gotten older, and just realizing that we've been human beings all along and that we've made all kinds of terrible mistakes and had all kinds of wonderful things that have happened and we have continued on. And so I think teaching them the resilience and that it's the journey and we're never really getting to the destination, but we're always on a way to another place. So as we wrap this up, so let's talk about, because we're always going to have funny stories. As a physician, there's always going to be some kind of funny things that are going on as we raise our kids. Tell me about something funny or interesting that you're not going to hear this when you're hanging out on the cul-de-sac or out at school talking with all the other parents. If this just happened,
No.
Radhika, tell us something.
I know. I don't know if I can come up with anything. I thought the nanny story was pretty funny when he called out all the names, but I think we've had so many mishaps where, yeah, I'm running from one place to the other. I'm wondering if my shirt's half unbuttoned and I'm going to a school event. I remember having to do presentations for him and probably feeling like I have to blow my nose and there's snot coming out of it just because you're moving so fast. And I've also threatened to quit and go part time a million times to try to spend more time with them. And every time I say that, they're like, no, do not go part time. Do not quit your job. You're around too much as it is. We don't want you around anymore. Yeah, I think I'd have to dig through the archives and I'm sure I have stuff documented, but it's been quite a ride for sure.
How about you, Jodi?
I think I've now put stitches in Ryan's head 5 times. And so I got to be on a first name basis with the nurse at school for a while when he was young. I don't know what was wrong with his right eye, but he just hit his head multiple times and needed stitches almost every time. And I would either go pick him up and take him back to my office and throw stitches in his head, or I did it in front of the TV at home a couple of times. Just throw on SpongeBob and throw an ice pack on it and then stitch him up right quick. So those are the things that you don't do if you're not a physician parent. Every time I do that, I tell my husband he owes me $1,000 for the urgent care visit. I don't get paid, but so those are the funny things. But I think there's certainly the village as a physician. Like I was in charge always of dropping off in the morning when the kids were in daycare, because that morning time was controllable. And so I could drop off but several times I pulled up to daycare and they were closed because there was a water main leak or something. And so then I would haul my little Riley and her baby carrier into the hospital because I had a meeting or I had an OR case, and the tumor registrar would watch her for an hour while I did my first case, and before I could get my mom down here or Mike could get back from work or whatever. And so it was always an adventure when, something like that happened. And then you just started rallying the troops. And thank God for all of those people in the world who just jumped in and said, oh, sure, I'll watch her for an hour until your mom can get here or whatever. Because there were a ton of those type of people in my life. And you had to have them as a physician because you didn't have options. You couldn't just cancel a surgery because the daycare closed that day. So it was a challenge.
Yeah, I think one of the funny stories I can think about with Kai, he had to have been 2, and it was Christmas Day, and there was a patient who had a postoperative bleed. She was 2 days post out, and we're ambulancing her from her house. It was pretty massive, and so I'm trying to coordinate all this care, and it's the afternoon of Christmas Day, and we're all supposed to be together, and I've got to go to the OR. And he throws himself on the ground and he's screaming, "That's not fair. It's Santa's day and you can't go." And he's having a conniption and he's so mad at me. And I was like, "Buddy, I'm so sorry. I got to go. But somebody's mommy is dying right now and I've got to go." So I go and I take care of it. And I come back later and everything's fine. And the next day I see the folks, and the husband of the woman got this huge dump truck that Kai could ride. And he wrapped it up and he gave it to him, and he wrote this really sweet card to Kai that said, "Thank you so much for letting me borrow your mommy so that my kid's mommy would be okay. And we're so sorry that this happened on Christmas, and we wanted you to have something special." And so he got that. So when I came home the next day, he's, "Mom, don't you need to go to work and get a dump truck?" He's like, "You need to go back to work. Isn't there something you have to do and get another toy?" It's like, "No, buddy, it doesn't work that way."
It's so funny. It's so true, right? Our patients give us so many gifts, which is so sweet, and so many things for the kids all the time.
Yeah.
Yeah. Oh, I
Yeah.
love that.
Yeah, they're so thoughtful like that.
They are.
How about your spouses? I feel like, we are very fortunate to have spouses that like you said, Jody, it takes a village. And there's just times where we can't be all things to all people in all places all the time. Tell me about your spouses. What does it mean to you to have somebody like that?
I think my daughter laughs because I say I never intended to have kids. I really didn't. It was like never even a thought in my brain. And then I met my husband and I'm like, wow, I could trust this guy with my children if I had them. And so that was the first time I really even thought about having kids, is when I met him and I thought that he would be a great dad. And he is a fantastic dad. And he's a rock, and he just takes care of things at home. Right now he's a stay-at-home dad and works from home, and he's great at it. And it just takes all the pressure off and allows me to really focus on what I need to do. But we struggled for a lot of years with the schedules, and he would go in really early in the morning. He would be at work at 5 a.m. so he could be off by 2:30 so he could pick the kids up in the afternoon. And then I did the mornings and then the late evenings. And so it's always just a juggling match of trying to figure it out. He was always there when I couldn't be. And so that took some of the weight off also. So that way I knew, okay, I can't make it to that game or that event, but he's going to be there. So that made it easier. And then he just takes care of those things that I can't. And it's a partnership, definitely.
Yeah, I agree. I think I'm in the same boat. My husband works from home as well, which has been great. And his journey started right as the kids were born because I never really got a maternity leave. I had to go back after about 3 weeks. And so we had twins, and he just took the bull by the horns, and he was super organized. He fed them, he changed them, he made them go to sleep. We say my daughter has swing syndrome because I think she probably spent way too much time in the swing. But he just handled everything. He cooks dinner every single night. He trades stocks and commodities. So he's done early too and does a lot of the after school stuff and a lot of the driving now that my kids are driving. But super supportive, and it's been nice that he's in a different profession than me because I think it gives them a little more empathy towards what I'm going through. And so it's been good. That's why I think it's so important to find a good partner. Makes all the difference in the world.
Yeah, I think we're all very well supported. I know that with Krista, she is a trauma surgeon. So some of her call is 24 hours in the hospital, but there's days where she may go a couple days without being in the hospital at all. And so it's always a tag team. And you just talk the night before about what the next day looks like and who's going where, and really just being so supportive. I think the other thing too, I've been very fortunate to have great staff members who have worked with me, because there's been times where Krista was on a 24-hour call at another hospital and I was stuck in the OR, and they've actually had to go and pick up the kids. So I think not just spouses, but also our extended family and the people that we invite into our world to really support us.
Yeah.
This has been a wonderful episode. Thank you so much for joining us. Now, the best part about this, I think, is that this is part one, and what's waiting for us in part two is all of our kids are going to come and talk about what it's like to be the kids' physicians and what they've gone through. We've just done our perspective, but really you're going to hear firsthand from these wonderful young adults about their thoughts and what it was like, maybe what they would do differently, maybe what they wouldn't do differently. but they're still going to come home to us. We'll see what they have to say. But I have encouraged everyone to please be as honest as possible, because I think that everyone in healthcare is really dealing with all the same things. So I want to thank you both so much for joining me tonight. And as always, thank you so much for joining us here at Soulful Surgeon. I'm your host, Dr. Lisa Hunsicker. Thank you for joining me on the Soulful Surgeon podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.